I'm Marcus Fernandez, Principal and Founder of CHE, the Center for Homeopathic Education. Today's episode is an excerpt of a webinar series by Dr. Robin Murphy. Dr. Robin Murphy was one of the most famous homeopathic teachers in the world, known for his books like the Repertory and Materia Medica, alongside his teachings. Robin had over 50 years of practicing homeopathy alongside naturopathic medicine and medical Qigong, and his knowledge knew no bounds. Robin taught in such a way that he made you feel that you could do it and empowered you to put what he taught into practice. So please sit back and enjoy this episode on case management. Hi, everybody, and welcome to today's webinar, which is webinar 3 of our homeopathic case analysis, case management webinar series with Dr. Robin Murphy, A&D. And today in webinar 3, Robin's going to talk about case management. I'd like to welcome you, Robin, for our last edition of on case management.
Thank you. It's my pleasure to be here again. I really enjoy doing these webinars. So especially this case management is one of my favorite topics in that, because I find in homeopathy, in general, it's easy to find that first remedy and to keep it going. That's where the real test is, okay? Find the right remedy, the right potency, and keep that case moving. And we have to keep our cases moving, and then the body repairs itself, and then we go to another remedy. So let's get started. And some of these slides I'm going to skip through pretty fast, depending on our time, but you'll be able to get a copy of the slides and read some of the details. Some of the 10 topics we're going to talk about here real quick. Introduction, the follow-up interview, what things we do, hearings, observations of healing. Some people say it's hearings law. I do not believe in the law of similars or hearings law, but I think they're principles, guiding principles. It's about how the body reacts, or the vital force reacts to remedies, evaluating the major symptoms in the case that you've taken, and how to use potencies and adjust potencies, different prescribing techniques and things like this. And also people on drugs and addictions, and also palliating and dying patients. And then at the end, we'll give a little talk on superfoods. And I'll give you the top 15 superfoods that I've used in my practice for the last 20, 30 years. Okay, so let's get going here. Okay, so introduction. Homeopathy is a green medicine. It's not only good for healthcare, but it's good for the planet. Okay, and even compared with herbal medicine, someone could go cut a whole field of echinacea down to make some tinctures in that. We could use 1 or 2 flowers and have medicine for 100 years for 1 million people from 1 or 2 flowers. You can't get more sustainable, more economical, more practical, more universal than homeopathy of getting the pattern of a remedy, especially if something's really rare and hard to find, a rare plant or metal, or platinum or gold or silver. We need so small amounts, just grains of something in that. And we'll get into some of these things when we talk about pharmacy. Homeopathy is a system of medicine used by 500 million people, according to the World Health Organization, and tens of thousands of physicians worldwide. Of course, in India, it's the biggest, and we have to salute India because the United States was the original big light for homeopathy, started in Germany, and then it went to the United States and first medical schools, and then with the onset of drugs and allopathic medicine, homeopathy in the United States declined. And it really has never recovered, except on a grassroots level. But we think in the future, homeopathy will definitely pick up. It usually picks up when there's epidemics or some type of problem that regular medicine can't handle. So there's been a lot of research on it, and there's a big bibliography of all the research of people who are into the research. Okay, I am no prejudice. We can read the research and be fascinated about it, or not look at the folklore, be fascinated about it. I just see it all as information to help us, understand homeopathy, what it does. Okay, things we're going to cover. Again, a follow-up interview We're going to look at chief complaints, etiology, timeline, the states of the person, and the major symptoms. This is basically our inner structure of the case that we talked about in case taking and that in case analysis. Then we're going to assess the remedy that we've been given and different things, different ways remedy reacts, new symptoms, old symptoms. We'll get into all that. Some will be going through quite quickly. And then we'll go through at least 10 different ways of prescribing. Because once you've taken a case and you've seen things aren't working, you might have to switch your method of prescribing. Now, also the potency and frequency and these other things. And then we'll finish up with how to integrate complementary therapies, mainly superfoods and herbal tonics. They will stabilize your practice and keep the health improving in people, even while you're looking for better remedies or the right remedy. Okay. So what do you do on a follow-up interview? The first thing you want to do, just like the first thing when you take a case, you want to let the person talk. Okay. What is their perception of how they're doing since they've been on a remedy? How long should they have been on a remedy? The average is a month. Okay. It'd be less if they're in acute pain or that, depending on what you're treating. If you're treating an emergency thing, you're checking within hours or minutes or within a day or so. Acute, within 24, 48 hours, but chronic, it's usually weeks. But again, you can have a chronic disease with some severe aches and pains, migraines, cancer pains, or something like that. Then you almost treat it like an acute. Okay. So that's a variable depending on what you're treating. So whatever comes up, you ask the patient how they've been doing. What have you noticed any changes in your health in general? Your scanning, anything comes up, you want to analyze it, get more detail. They say, "Oh, I think my memory's better." I'll give me an example. "I haven't lost my keys this week," or something like that. Or "I didn't forget where I was going," or anything like that. Scan, analyze, and probe. Okay. And that clarifies the symptoms and that. And it's a very important idea to do that. Say, "Oh yeah, okay, that's better." No, you have to see how much better. Sometimes I ask people a percent or a 1 to 10 scale. What percent do you think your arthritis pain is better? And you'll be surprised. They might calmly say, "Oh yeah, my arthritis is better." And then they look and they think about, "Oh, it's 75% better." Okay. Or 20% better. Yeah. As long as it's better, it's going to be hard for me to change that remedy. Even 10% better. For example, someone had arthritis really bad for 10 years. They come in and they're 10% better, or they didn't need to take their pain medications or things like that. Then say, "Wow, we got 10% a month. In 10 months, it'll be gone." Okay. Versus 10 years they've had it. And usually that's not the case because the remedies get momentum and all that. But even 10, 20% is a big step forward because you stop the progress of the disease going downward, you turn it around and you've improved it. Okay. The next big thing you do when you take in a follow-up interview is you actually go back through your old notes. Okay. So I don't look at my old notes. I just start a new sheet of paper and start letting them talk and get all their ideas about what, happened since they've been on the remedy. Then you pull out the old sheet of paper, which is a portrait, as Hahnemann said, a portrait or image of their disease state or their vital force. And you read back through it, say, "What about this? What about that?" And you will be amazed how some things got better and they didn't even realize it. Okay. And I give a lot of examples in my lectures. Really conservative, elderly people, and it's hard to get symptoms out and this and that. And you ask them if they're better or not, and they say, "Oh, nothing's changed." And one example I give a couple in that they started dancing classes, they're planning a cruise, and all this before they had no energy and this and that. So once you read that case back, "Oh yeah, my constipation's better. Oh yeah, I'm sleeping better." So natural healing can be deceptive in that it can heal so gently and naturally that people, it's like they never had the problem and they're not even thinking about it. And the other extreme is they have severe problem. They come back and they tell you it's a miracle. They've never seen anything like this. And why didn't they come to homeopathy earlier and this and that? Okay. No matter what happens, I always review the instructions I gave them, and also look for any interfering factors, obstacles, especially they say there's been no change, and you've read the previous notes, and yes, there's no change, then we have things that we can approach with that, what to do. And also check, like I was just saying, changes in their life, work, drugs, or diet, that they attribute it to the positive or negative or the no changes in their case. Okay. Scan quick. Anything new in your life going on or your work? Oh yeah, they put me on a different time shift. That could change your whole case. Now the person went from late work to early work and they're sleeping better. Was it the remedy or was it the change? Or the doctor increased or lowered the drugs, or they changed their diet. We usually try to get people not to do any major changes while they're on a remedy until we know that that remedy is working. And sometimes if I'm adding superfood and herbal tonics, I may add it the second visit, or once I know I have a good remedy, then I can add things. Or if the case isn't going well, or the remedy didn't work at all, I could add superfoods or tonics to give them a boost and then try a new remedy. So as long as you know where you're at and what you're doing, you can follow it. Okay, then you have to decide whether the treatment you're doing, the remedy or acupuncture, whatever, is working or not. And from that, you have your options. And you write up a new plan and a new assessment. So basically, we got our same SOAP thing. Subjective is them telling us what they believe is going on, and then we question them. And any change in lab tests, discharges, objective things, signs, that levels of pain, and we come up with our assessment and our new plan in that. So that's pretty easy routinely to go through. Okay. So always keep in mind to check the chief complaint. Why? Because this is what people came to us for. Okay. We're here to serve humanity, to help people, not to serve our philosophy or theories about health or disease. Oh, this is good for you because, or that's bad for you because. What do they come to us for? A young girl comes for pimples on her face, and that causing all these psychological problems. So I would give a remedy to help the psychological and the pimples. Calibrome, lycopodium, pulsatilla, good remedies. So you consider that chief complaint. Okay. Sometimes we don't aim to remedy at the chief complaint, and that's valid. Chief complaint may be, like I just said, cosmetic, and there's some big, deeper issue. But still, we check the chief complaint. Also check any diseases or clinical states they have, psychological, depression, panic attacks, asthma. Are they better, worse, the same, or that? 3 options: better, worse, or the same. Or 4th option: some things better, some things worse, which we'll get into. And then you also want to gear in when you're making your assessment on any major symptoms. Okay, like the case we did last week with the headaches, type 4, bold, capital, and underlined symptom. And I would look at the headaches. How are your headaches? And if the headaches are better, it's a big step forward. Okay. Your general idea with homeopathy and in any therapy you're doing, medical Qigong, meditation, anything. If it's helping us, it should move us in the right direction. Health is regaining our health and anti-aging and wellness. It's all the same path. Okay. All we want to do is see movement upwards, and that's the vitality. Okay. There's actually a heart rate variability test. You can actually measure the overall health and the vital force and autonomic nervous system. If the heart rate variability increases, you're rejuvenating that person or healing that person. Okay. So anything that comes in and attributes to us walking up that stairway or restoring health that Hahnemann says is good. Anything that adds to disorder and sends us backwards and stuff in general is bad. And this is a better way than a linear way of looking at it. This is the genetic optimum state of health you were born with. Okay. Here we have our epigenetics, things, lifestyle, family dynamics, relationships, work, school, that gives us our personality remedies, our big polychrist, and that's usually laid on right after being born. Okay. And then from that, we're susceptible to get certain diseases or problems or shocks or trauma, grief, head injuries, and that pops out. And from that, you can get more serious diseases, cancer, neuropathies, and these things go out and then on down. We want to go up. Now, they say health life is a bell curve where you start and you peak in your 20s and you deteriorate. We don't really accept that, or I don't accept that. I think you can get healthier and pass away in a healthy state of conscious without drugs or medications or pain or disease. That's our goal. Okay, we don't try to avoid death, or we're not trying to cure everybody. We're just trying to move them to a healthier state. And then they have the knowledge to stand on their own 2 feet. Okay. Versus drug dependency, just being on a opioid drug for pain, puts a downward spiral, okay, to addiction and all this stuff. Not much to say about this, but say this is an original case, someone comes back, this is 20, 30% improvement. You may just see everything lessen. That's the intensity of the symptoms. This 4 went to a 2, this 2 went to a 1, etc. Okay, some things might stay the same or increase in that. But the overall state, when you do that interview, when you do your assessment, oh, the patient's better. Okay. Sometime I ask them, what do you think? Oh, I think I'm 50% better. Oh, I think I'm a little better. Okay. But what they're a little better of was very important. Then, oh, that's all there. But we want to see that movement up to higher states of health and being in that. And as they move higher, the symptoms and the blockages and limitations of patients should get less. Now, how do we know all these things are happening? 2 things: is signs of health and hearings, observations. I like to even the word observations better than principles. But I do believe principles. Principles aren't laws. Principles are guiding things that you take in mind when you're making decisions. Okay. Principle finances or architecture, they're not mathematical laws that are reproducible. Okay. But way back in Hahnemann in his 5th edition, 6th edition, Organon, he kept talking about remedies when they react and how can you tell if the remedy's working or not. Okay. Now you want to keep in mind one thing, that all the old books and all the modern books that talk about Hering's law, that Hahnemann and Hering and Kitt's the one that really made it famous, they're really talking about skin eruptions. But we can still get stuff out there that guide us in general of whether a remedy's working or not. But Hahnemann, Kent, Hering, they were talking about a skin eruption being suppressed, and then it moves through the body in this way and comes back out and that. Okay. We also see in general, not all the time, but 80% of the time, this also follows symptoms moving through the body. Okay. So if symptoms move to a different part of the body, you just quickly know whether that's a good direction or bad direction. Okay. Because sometimes the patient will complain. Also, sinus and discharges coming back. So let's look at these. Just have a couple slides on it. And you can read in all the books about it. Just know it's not a law, it's not fixed. It guides you to your assessment. Healing takes place from within out. And I agree with that in general. On that, unless you have some severe pathology like gangrene or cancer on the end of the body, that healing will start take place first. But in general, the old book said from within, from without, from the center to the external. So all kinds of ways of saying this. Classic one that I've taught and seen many times is asthma. Okay, a child has eczema. You take the child to the dermatologist. They put ointments and creams on, cortisone, and eczema goes away. And a few months or even a year later, the child starts having asthma. Okay, even sometimes a few weeks later. And that, let's say, oh, it might be a side effect of cortisone. Either way, that eczema was suppressed into the body. Okay, and now we give a remedy like arsenicum or lobelia, one of our top remedies for asthma, and the person feels better in general. Okay, and then the asthma goes away and the old skin eruption comes out. That's the best sign you could ever see in a homeopathic case where it has that history. Okay. That's a sign of a perfect cure in the right direction and everything. Now, if they go put the ointment back on or cortisone cream back on, they can drive it back in and the asthma comes back out. And believe me, I've seen cases where this has happened 2 or 3 times before the parents were convinced. Okay. And then I got smart about it and gave an acute remedy for the eczema. Child's itching and screaming, not sleeping, and all this stuff. But all these other things went away. Food allergies, colic, everything else, asthma, all this went away. And now it's just eczema. But something comes out, a vaginitis comes back, sinusitis comes back, a skin eruption comes back, herpes comes back. You are justified to stop and give an acute remedy for that. Okay. If you think they're going to run back to their doctor and get an ointment or cream, which just prolongs the case. Another one I've seen very important is that symptoms move from the more important organs to the lesser ones. Okay. So the body has a hierarchical self-defense mechanism, just like the military. We had a fort in certain part of the military, the fort is being attacked. We would send more soldiers over there to reinforce it. The front gate starts being attacked. We would send more soldiers to the front gate and ignore the side gates. And likewise, the heart or lungs are involved, and that you give some remedies, and now they get something in their liver or colon that's moving in the right direction. Okay. Things move from the brain to other organs, from the heart to other organs, and that. How do you know how important an organ is? Organ failure. And how long will a person live? Heart comes first, and then the brain, and all these things. Bigger organs to smaller organs, physiologically. Above, downward, a lot of people go by that. I think it's the least important. If your symptoms started, say they started in the face and you give someone a remedy and the acne or eczema moves down to the arms and all this, that's a good sign. But in general, it depends on where it began. It might begin below and move up. You just trace it back. So I don't pay attention to that one. Okay. Reverse order of appearance is a big one. But keep in mind, that means the vital force is a functional vital force. It's not collapse and doing all these weird things like some autoimmune diseases and stuff. But if someone had headaches 5 years ago, you give them a remedy for some food allergies or general polycrist thing, and they did well for 3 weeks. They come back and said, now my headaches are coming back. And the first thing you say, have you had these before? Yeah, I used to have these in college. Good sign. Okay. Symptoms coming back in reverse order, especially after a period of amelioration or improvement. Okay. And all this depends on the remedies you're given and the vital force and some other things. Okay. So let's skip that one. That was just another one, a picture of herring, historical picture of herring. So another thing here, symptoms moving down to the top. Sometimes it helps, sometimes it doesn't. Some of these are very important with paralysis. Say paralysis started in the feet, colonium has that, and multiple sclerosis started going up, then the limbs got it, numbness and tingling. Now you give a remedy, and now the arms get better, and then the feet get better. That I've seen. Okay. Skin problems, they can be anywhere. Okay. Start on one side, go to the other side, whatever. Okay. Then the reverse order of appearance. Just your timeline again. Knowing your timeline from your case taking, you're on solid ground. But always anything comes up. Did you ever have that before? They say yes. That's a good sign, especially if it was preceded by improvement. From within outward, when the vital force is circulating and spinning and your blood is moving good, it would tend to throw things outwards to the surface. But that also means through diarrhea, through the vagina, through the sinuses, through the skin pores and everything. And again, more important organs to less important. Now, keep in mind, this applies to any therapy that you're doing. Acupuncture, Ayurveda, massage, body work, allopathic medicine, anything. You start a new drug on the patient, and they have side effects from a less important organ to a more important organ. So you're treating the liver for hepatitis. Now the patient's more depressed, moving in the wrong direction. Okay. I've yet to see any allopathic drugs move things in the healing directions. They can palliate, they can relieve the pain, but the patient's overall vital force either goes down with the more the drugs take or it's unaffected. Okay. And we talk about the lightweight drugs can the vital force stays stable. The heavy toxic drug, it pulls them down with it. So the more you take the drug, the sicker the patient gets. And they call it side effects. Only because they didn't want them. We're going to look at this. Also, this is what I've relied on for many years. When I'm taking that follow-up case and I'm doing AP, scan, analyze, improve, I'm looking for the signs of health. There are certain signs that emerge, and when these signs emerge in the case, you're on solid ground that the remedy's working. And it may be a nondescript thing or some general vague thing. And that's why it's important to realize this. And people have many cases in the clinic, and people will come in, and the student will look at the case, and all the students will say, oh, this patient's not working. I'll point to one sign of health, and I say the remedy's working. Okay. And then the next month, the patient comes in, and their improvement kept going. So it was radically changing our prescription. Look for the signs of health. And we'll go through these real quick. And so I won't talk about them now. So the first sign of health is improvement in chief complaint. Okay. Whether it's a disease or what they want help with, it can be a minor problem or that. We at least know that remedy is the correct remedy for that chief complaint. Okay. So we see some general improvements, a sign of health beyond that, then it's a bullseye remedy. It's the right remedy. Okay. Sometimes just the chief complaint gets well and nothing else, and that's still fine. Then we found an acute remedy for them. Okay. And you keep up, and you might look for your second choice remedy from your previous visit or something like that. So we get more in that in detail coming up. Improvement in sign and symptoms. What's that mean? Intensity, limitations, the amount of suffering, the amount of pain are less. And I asked them, how much less? Oh, a lot less. What percent? Or on a scale of 1 to 10, percent a little better. People have a better sense of that. Oh, over 50%. Oh, 80%. Oh, it's gone. Okay. We can't ask for anything more than that. Right. And again, on all of these, we're checking the signs for these signs of health and checking it with Heron's law. So the symptoms are totally gone. Okay. In that, but nothing else came up in its place. A good sign. Okay. So chief complaints better. We always look into that first because that's what they want help with. Any of the major signs or symptoms are better. That's a sign the remedy's working. In general, I'll give you exceptions coming up. I can hear people thinking. Okay. Increased vitality. The remedy gives a person more energy. I had a case this week, and a woman came in, and first thing said, oh, I have more energy. I'm sleeping better. Oh, this and that. I just said, how are you doing? Have you noticed any changes? First thing said, more energy. Now, you can drink coffee and get more energy. You can take amphetamines to get more energy. But increased vitality is different. Okay. Increased vitality is a sense of being grounded, sense of having more stamina, sense of having a clearer head, and some of these other things we've talked about. And a sense, unconscious sense that your energy field is stronger. Okay. Increase energy, and you combine it with these other signs of health, but you feel calmer. That's the sweet spot that most 90% of medicine, alternative medicine, don't even look for. Okay. It's a big paradox. I have more energy when I feel calmer. Everything else in herbal medicine, allopathic medicine, body work, acupuncture, all that, you're stimulating the body and you give them more energy. Okay. And that rarely calms them down too. If it does, the acupuncture, the homeopathy, the herbs are perfectly working. Okay. But you can get more energy just by taking a drug. But vitality is different. It's a quality of the energy. It's a earthier energy in that. The fourth big sign of health is improved sleep. And that means they wake more refreshed. If I see that one symptom and sleep was an issue in the case, this is how important this is. Especially if sleep was an issue in the case, it may not be the chief complaint. It may not be a major symptom. But they said, now that you mentioned, I'm waking up easier. I don't need coffee and a shower and this sluggish, heavy feeling. Big sign that you reset the vital force, which is the autonomic nervous system. This is one of my favorite things to look at. Okay, these two right here. Some other ones can be intellectual, but these are pretty there. Oh, and one of the key questions here is you ask, especially if they wake up to urinate at night. And if that's better, big change. I mean, I talk about this in my other lectures about just waking up to urinate and turning on the light. You're stopping the growth hormones, the melatonin, all these things for that night. So you're interrupting. It's like you're interrupting your computer while it's downloading or resetting itself. Okay. So you want to get people to sleep through the night. Big sign of health. It might be one of the biggest. Daylight hormonal change. You guys, people just change their clocks from summer to spring, daylight saving. That drills people will cost $1 billion. Car accidents go up, death rates go up, everything because we changed the clock 1 hour. This is how tuned in our vital force is to the sun and moon cycles and stuff. Okay. So adaptability, another one that's easy to check in a case. Is that person more adaptable? And that means their allergies, their ability to handle stress, their ability to handle weather changes, temperature. They can eat more foods without problems. This is dealing with your Wei Qi or your energy field is stronger than that. It even goes to the level of deep psychology. And I've told many cases in the past. One woman was married to an alcoholic, and every evening the man would get off work and go to the pub or the bar, as we say, and get drunk and come home and be violent every day after work. Okay. So I treated her case, and of course the husband's not into being treated, so I gave her staphysagrin and gave her 200 or 1M, a 1,000 C, and 1 or 2 doses. And she comes back a month later, and I said, how's your health and this and that? Not much has changed and this and that. And I said, how are you dealing with the stress of your husband? No. She says, now that you mention it, I have to tell you a story. I've heard it several times. She said, he came home yelling and screaming, and I looked at him, and for the first time, all I felt was compassion. I felt sorry for him. And every time before that, I felt devastated and worthless, and it was my fault and all that. And it was just like watching a movie. Okay, so she adapted to that deepest stress in her life, and she felt sorry for him. And that, and a few months later, she divorced him. And we're not giving remedies to cause divorce. We're giving remedies to make people healthier. What they do with that is up to them. We don't judge it. But I've seen that where they stand up all of a sudden, like a podium, staphysagrin, carcinosis. They stand up, they're more adaptable. They're not going to take it anymore. Okay. And the sixth sign of health is calmness. And this lady had most of that. She felt real calm and compassionate, and then just felt sorry. It's like, I never seen it before. It's like you're in the bubble and you're being attacked and everything's all upset. And now you're outside it and you just look at the person and you feel sorry for them. Or someone has to give a talk in front of a group and they went through it, with flying colors, their exams in college, whatever. I have a work and you have a boss that's real domineering. And now, yeah, he yelled at me, it didn't bother me. That sense of calmness. We're not talking about symptoms going away. Well, of course, if your panic attacks are there and the same triggers happen, you're more calm. But they say, yeah, I can't really describe it. I just feel more calm in general. Okay. And that big sign that inside calmness and sense of peace and stability and less sensitivity, which is number 5 here, hypersensitivity and stuff gets better. Okay. In calmness. These things are general. And at the end, I'm looking, if it's this remedy working or not remedy, can I ask some of these signs of health? I go out and ask them. Yeah, it was real chilly. We had a storm and didn't bother me like it usually does or something like that. Or I was under distress and and I didn't get upset. Really big hints. I've never seen these in any other books or anything. Also, one is called contentment. They can't put their finger on it, but they just feel more content. Okay. More satisfied. I learned this from the children. Okay. From the teething children, the colicky children, the children with earaches, and you give that remedy, and they're so hard to please. I tell story after story. The child's calc-phos, chamomile, pulsatilla, yelling and screaming. Not so much pulsatilla, but these other ones, tuberculina. I want ice cream. I want ice cream. I want ice cream. You go out in the snow, and they'll go down the store. You come back, get ice cream. I don't want that kind. I didn't want that. So hard to please when your vital force is out of sync. That person has no inner contentment. Okay. You give calc-phos, a big one, or chamomile, and immediately they're easy to please or they feel more satisfied. Okay. So that removes some of this mental or emotional dissatisfaction. That person, why? Because inside they feel there's something wrong with them. There's something sick and they can't make decisions. Now they can make decisions better and everything. Okay. And keep in mind, these are the same signs of health. If you're starting a new tonic, a new exercise regimen, new breathing exercise, new drug, body work, anything. If these things come out, you've touched the vital force, you reset the autonomic nervous system. Another big one is clarity of mind. And some people just come back and they feel everything seems clear. Not just brain fog, but that's part of it. The poor memory, mental functioning in general, slowness of the mind, dullness of the mind, all go away. Okay. So as we get sick, our mind is restless, our energy is restless, we're hard to please, we're dissatisfied, we're anxious or irritable, we're not calm. And when you touch that vital force, these come up. Okay, sense of clarity removes all these things. Okay, a couple more here. Motivation. Like the case I said earlier, this couple were depressed and down, no energy and on each other's nerves. And we call it cabin fever in America or English. And I gave them remedies. They came back and said nothing's changed. I looked into their life and their whole life changed. Okay. They're taking dance classes, they're going on cruises, they're more sociable, they're going out to eat, all these things. Okay. You also see what remedies, calcarea, nux vomica, these remedies, people with chronic fatigue, that they're more motivated. Oh yeah, I took the remedy. Anything happened? Well, no. The husband's right there. Well, you cleaned up the whole house and the garage, which you've been saying you're going to clean for years. You will see people become more organized and want to clean and organize things, or they did stuff they haven't done for years. Some things that were on the back burner. They're more motivated, and they come in with that spark in their eye. Now they've seen this remedy work. They're really motivated. What else can I do? I give them a qigong exercise or a superfood to add to their remedy in their whole program, because now they're ready. Now they'll listen to me. If I give them a long list, here's 10 supplements to take. I want you to do this, and all complicated. That's not healing to me. Okay. Now we're we're dependent on supplements or drugs. We want to move people away where they're just eating better, exercising better, taking their remedy and moving them up that stairway to higher states of health. Some people feel tranquil, a higher state, more harmony, more connected with the earth, the sense of other people. We know that mirrors, Ignatius, some of these remedies feel disconnected. Sepia is another big one. They hug someone and they really don't feel anything, and that type of thing. Or you hug them and they just feel cut off. Aurum is another big one. So the sense of being connected socially, relationships, and the sense of peace. Okay. Dying patients or patients with real severe mental illness, you can give them a remedy and they can go into tranquility. Okay. That could be a sign it's palliating or the deepest sign the remedy's working. Okay, I think there's only two more. And then compassion. I learned this from the children too. Now, we're not giving remedies to make people more compassionate. But if this person's irritable, domineering, critical, all this stuff, and you give a remedy and they come back, and those things start dissipating. That's because compassion has manifest or is arising in that person's inner being. I learned this also from the children, and I had several cases, many cases, where the children were what do you call it, um, violent or tortured animals or insects or kicked their dogs and did all this stuff. And some remedies, anacardium, tuberculinum, they switched from being loving animals, treating animals badly, or people. It's no difference. The parents were treating their children bad, and you give the parents remedies, and all of a sudden they're more compassionate. Okay, now all of a sudden the child is loving the animals and never yells or kicks or screams, which are often just imitating how the parents act in that. So a sense of love and compassion that kind of connects with that harmony, feeling connected with people and this and that. So you become more humane when your vital force is healthier. When your autonomic nervous system is more in sync, you broadcast that, okay, with your behavior, your thoughts, and your deeds, and all this type of stuff. And last but not least, they did all these studies on heart rate variability, and they tested all the emotions. And whenever I asked that in the group, they said, I say, what's the highest emotion? Everybody says love. And actually, it was gratefulness. And love was a close second, not putting down love or compassion. Okay. Love can be actually up here with compassion too. Okay. They feel connected, or they're able to love, or that love and compassion are very similar. Okay. Just beyond what you call love, physical, mental, emotional, love for humanity, love for animals, all this stuff. I see people change their diet after remedies are working without me ever having to say anything. They just, I don't want to eat that anymore. I found out how they treat the chickens or the cow. I don't want to eat anymore without any preaching about what's good or bad. But gratefulness, this is something I don't look for, and they don't volunteer, but you see it either in their eyes, or when they come back, they're just glad to be alive. Okay. You wake up in the morning, you're glad to be alive. That extends your life. You wake up in the morning, oh, I got to go to work. I got to exercise. It's the exact opposite. You're aging just by thinking that way. And that these things can be tested. Okay. By testing your heart rate variability. Okay. So all this connecting with life and just waking up in the morning, that's a good ritual for all of us, especially homeopaths or on your way to the clinic. Just be grateful that you have an opportunity to help people, and that even whether it works or not, you at least had the opportunity to help people. You had your superfoods and all that. You basically want to help everybody, just more or less in that. But the whole idea with this is to keep the case moving, and to keep the case going. 2 visits, 3 visits, 4 visits, depending on how long the problem is and how deep the chronic disease is. Okay. So now we'll go up to section 5 here of this, and a lot of material. I know I'm going a little fast. We'll go through some of these. What can happen after you give a remedy, or evaluating the symptoms or reactions to a remedy. People have whole books written on this stuff. Okay. So we're going to cover it in 10 minutes or so, and maybe 15. Just a quick little zit. If you have, you check the signs of health and check Hering's Law, that will help you guide the meaning of this. Without having these principles or observations to guide you, you don't know what these really mean. Okay. And so I use them both. If you just use Hering's observations or principles, it can be a little tricky and misleading. Okay. It can move in the wrong direction according to one principle, and the right direction according to another. Okay. It might move from above downward, but not in reverse order or vice versa. So by checking them both, these signs of health emerge, the remedy's working. Okay. Then how well they're moving in what direction will give you more information. People come in, they sit down, you ask them what's going on, and you get their whole follow-up interview, and now you're analyzing the follow-up interview. Okay. Determine whether they should stay on that remedy, potency, frequency, dose, or whatever. Basically, symptoms can get better. Symptoms can have no change, or the case can be better, The case can have no change. The state, the etiology, chief complaint, symptoms, just a keyword here. Or people come in and their symptoms are worse, the case is worse, the state is worse, whatever. Or some old symptoms are coming back, or they have some new symptoms, or the symptoms are coming and go, or the symptoms are still there, but they've changed. Okay, burning has changed to different rawness or achy pains or something like that. Okay, there's probably some more things here, but that's enough to cover 89% of what. Okay, so I have over 5 or 10 of these charts like this, and I'm just going to talk off the top of my head on some of these things. Someone comes to you and they come back and they say there's no change. First thing I'd say to myself, I don't believe you. To myself only. Okay, you have to prove it to me by me rereading the chart back and checking everything they told me, every symptom they told me, and all that stuff. Follow-ups are usually half the time, half hour, a severe case, an hour follow-up. But if they pass all that and there's nothing been changed, no change in intensity, limitations, you look in their life and all this stuff, you want to look for signs of health even then, because these signs of health aren't their symptoms. They're not, they didn't come in with chief complaint of these signs of health. Okay. And that. So you'll be checking more for signs of health. If you see signs of health comes and there's been no other change, you might want to stay on that remedy, but increase the potency and all this. Okay. So basically, this could simply mean the remedy's not working. It's the wrong remedy. Okay. And that's, I write it down, that's obvious. You reevaluate, you go back to your previous case analysis, and I often have 2 or 3 remedies in my plan. Just doesn't work. These are my backup remedies. So you can change the remedy at that point. Not a big deal. But I also at that time would add a superfood or a tonic, just especially aimed at their chief complaint. I want to make sure they get some benefit from the homeopathy or the superfoods or tonics and that. Also, if they come back, check for obstacles to the cure. Strong essential oils being used around the time they're taking the remedy, the drugs that they're on, if they're taking the remedy around that time, or the potency wasn't high enough, there's just some simple thing to do. Okay. But even a slight sign of the health, signs of health emerge, I might increase the potency, frequency, or dose. And we'll talk about these things. Okay. If they enter anything new in their life, as I said before, check. A new medication, changing their job schedule, changing relationships, all this can disrupt or cloud your image of what's going on in the case. But no change, remedy may not be working, the potency's too low, there might be an obstacle to the cure or some new factor in the case. Okay? And I don't know why that one's black. We'll skip it. Okay. Symptoms are better. Okay. You want to say, definitely, they're looking at you, what everybody believes, that's better. So the remedy's working. And that's don't change anything. Don't change potency, frequency, or dose. Sometimes you can get 1 month, 3 months, 6 months. Who knows? It's not up to us to decide, and some book can't tell you. Oh, if you're treating diabetes and they're not better after 2 months, switch your remedy. That book doesn't know the case, doesn't know the person, doesn't know how old they are, how late stage or early stage the diet, nothing. Get out of the book knowledge to learn how to think and perceive yourself. Don't let the book tell you what to do. Okay. And that, so usually continue the remedy in the same thing on that. If the symptoms are better, but you feel it's sluggish, you can change the potency and frequency and dose just to give it a little kick. Okay. And that we get more into that coming up. Or the symptoms are better, the remedy may not be working. If some superficial things are better and nothing else has changed. Okay. Or symptoms are better and the person's worse. Okay. That could be a sign. Symptoms better, wrong remedy. Okay. And these are obvious. Okay, my arthritis is better, but oh, I'm so tired. I've never been this tired. Oh, I can't sleep. Oh, last month. Don't keep giving that remedy just because the arthritis symptoms are better. Okay. And there's no evidence on the signs of health or Henry's law that they're better on the vital force level. Okay. So symptoms better just doesn't mean it's always working or not working. You scan, analyze, and probe it. Okay, couple more of these here. Symptoms worse, which people call aggravation, to address that a little more after our break. Symptoms worse could be a good sign the remedy's working if what they have is worse than that. And you have some signs of health that they're better in general, but their chief complaint or disease state may have gotten temporarily worse. That's one of the best signs. Maybe a sign that the remedy's a little too strong and all this, but I would often lean toward keeping on the remedy if they work through any aggravation that they got. Symptoms are worse, but the person's not worse, or there's no change in their general health. That usually means it's the wrong remedy. Okay, change remedy, potency, frequency, and all that. Most of this is common sense. Okay, and then just a few comments about aggravations. You can have positive aggravations and negative aggravations. Okay, a positive aggravation, classic is that you get aggravation and amelioration. All the homeopathic books. I believe in that, and it's the way. But the stronger aggravation usually means the potency was too high. You drink 1 cup of coffee, you get energy, you go off to work, you have a good day. You drink 3 cups of coffee, you get a migraine headache. Homeopathic remedies are dose dependent too, or potency dependent. Okay. You give a 6C 3 times a day for a few weeks, the person has energy, feels great. You give a 1M once or twice, you start the case, the person has an aggravation. Doesn't mean it's the wrong remedy. It means it was just given too strong. Whether it's opium or statin drugs or antipsychotics or antibiotics, if you give it too strong, you're going to get aggravation. Homeopathy is no exception to that. Okay. You can have big aggravation not followed by amelioration. That's a negative sign. Okay. And again, I'm checking the vital signs here. Some things are better, some things are worse. Okay, that could be the remedies could be working or not working. Okay, if some things are better, some things are worse, and the signs of health are better, good sign. Okay, you keep plowing through with that remedy, and the vital force will become more stable. This is actually the healing process going on. Some things are better or worse. The person's not better in general, then you want to look at a new remedy and that. And don't make it intellectual. You just ask the person in general, look at their energy, their sleep, their general things, digestion, a sense of well-being. Now, any of those are better, the remedy's working. Okay. And if they're worse, something's better, worse. Arthritis is better, this is worse, vice versa. Just look beneath that. Symptoms changing and bubbling, we want to see some change in the symptomatology. Else the remedy's not working. Okay, just a couple more of these. And then the new symptoms come up. A new symptom can be a very positive sign. For remedies working, resonate with that person so well, it might produce some of its own symptoms. Very positive. Or it could be a sign it's the wrong remedy. Okay. Example, nature mirror. Give nature mirror someone had devastating grief and can't cry and headaches and all this stuff. And you give nature mirror 6C or a 200C, and they come back and they feel better in general. They're sleeping better. They're not as depressed. And they say, but now I've been craving salt. Good sign, because that's the keynote of that remedy. And so it could be a good sign. Remedy not working, they have all these new symptoms they never had before. And they may or may not be part of the remedy. You can go check the Materia Medica, but the person's not better in general. It's always back to these things here. Okay. And then you should change remedy, potency, frequency, and that. Okay, I think this is the last one. Then we'll take a break. Old symptoms come back. Could be the best sign of it all. Most of the time, it is a good sign, especially if there's a period of time, weeks or months, or even days where they had great amelioration. They felt great in that. So your vitality picks up, it kicks in the immune system, and the immune system starts working on things in your body on its own little schedule or plan. It may not be according to Herring's plan or principle, but once it starts working, it decides, oh, I got to deal with the gangrene of the foot, not the psychological things or the diabetes. Okay, the whole immune system's focusing on saving the leg. Okay, or someone has itching of the skin, they can't sleep and it drives them crazy. The immune system saying, do that, treat that. So old symptoms come back in general is a good sign, especially if it's preceded by that. Old symptoms coming back, but the person's not better, then all this, again, same situation. Okay, and the last one, symptoms are changing, and that, again, check the signs of health, check the Heron's principle. It's very simple, same symptoms coming and going. But the symptom can still be there. Instead of numbness, now it's more cool. Instead of burning, now it's more radiating pains. And that could be a sign the remedy's working if there's other signs of health coming up or symptoms are moving in the right direction. Okay, symptoms change and there's been no other progress in the case. No, the remedy's not working.